Spencer is the best agility dog I've ever had. He's my 7th agility dog, and he was by far the easiest to train, and he really loves it. He loves the sport. He loves to do stuff with me, and so that's why he just excels, and I'm so proud of him, and we just have a great time together. I was so excited when I found out we qualified for nationals, and I was a little nervous the first year because I didn't know if my knee was going to hold up. And as I would be running agility, by the end, I was in a lot of pain. I finally decided to go to the Ohio State University Wexner Medical Center and get an assessment as to what was going on, because nationals were coming up in March and this was already February, and I wasn't sure I could even run.
She came to us with a pretty significant meniscus injury, and you could tell how distressing this was going to be because of her athletic pursuits with her dog and the dog agility competition. So we remember feeling like how high stakes this was for her.
In 2024, I had some injections of some medication. It got me through, but I didn't feel great. I was able to run. At the end of each competition, I'd put my knee up, I'd have ice packs on it, and I wore the brace all the time.
What can we do to try to stimulate some healing, but not have too much of a trade-off in terms of how quickly we're getting her back? And so that's when PRP came up in the conversation. Platelet-rich plasma, it's a really easy in-office technique to try to stimulate healing. So platelets are the body's natural repair cells. So all we're doing is drawing blood from the patient. We take it, we place it in a centrifuge for about 30 minutes. That's going to concentrate cells. So we take that and then we apply it to the site of injury to try to get a boost of natural healing.
In 2025, I wore the brace for stability. I ran much more fluidly. I was able to actually run and not be in pain. And I go back to our room at night and I wouldn't have to use ice or anything. It was amazing. It was like I didn't have a knee problem.
We were so hopeful for her because we could tell how much this meant to her. We were invested too, and so I'm like, man, I really hope this works for her. And so we were elated to see that. And that's why we wake up in the morning. That's why we work so hard to train up all of our teams to deliver this kind of care. It's why we work hard at research, is so that we can find these things that are going to help these patients.
It was amazing. I didn't even realize it was working at first until one day I realized I could get out of bed without holding onto my dresser to push up. And I thought, I'm going to be able to run great this year. And we did. We ran great. We ended up 24th in the country of those competitors who went to the AKC Nationals. We were 24th in our height group of those who competed. So I consider that a huge success.